Sailor, Sailor.
Mornings are busy in the Neonatal Intensive Care Unit, or NICU. Today, Sailor has feeding lessons and a visit from the doctor.
So I think we might have to start with a bottle.
She likes to just fall asleep.
Yeah.
Okay.
So if she's ready, we're ready to try it if it's okay.
I think so.
Yeah.
Many premature babies need help learning how to feed. Sailor has an occupational therapist to help her do just that.
So I'm gonna have you maybe open that one. We're just gonna potentially get the bottle ready in case she's really ready. Oh, that was good. Has she done any better rooting for you?
A little bit. I do notice that moving her face forward or her mouth forward and sticking her tongue out.
There we go. I'll do that. Thank you. It's coming, honey. This is coming. All right, so I'm gonna watch her really close for stress cues.
Okay.
So look at that rooting, it's so much better.
Sailor's parents had several weeks to plan their baby's care after a doctor told them that she was developing a bit slower than normal.
We knew she was going to come early. She was IUGR, it's considered intrauterine growth restricted. So we found out about around 20 weeks. We were seeing Dr. Wechter at Covenant already. So we were prepared to be here and deliver early, but we did not, I didn't know what to expect after she came.
Really?
It was just a matter of getting her here and safe and healthy, and then I wasn't sure what to expect up here.
Sailor is just over a month old. Her birthday was supposed to be 2 weeks from today. Luckily, she found the help she needed here at Covenant, and she was put on this ventilator from the day she was born.
Sailor was on this piece of equipment for around 11 days. She had some air leaks in her chest. She had what's called a pneumothorax, and she had multiple chest tubes. So it was really beneficial for her, because imagine if you have a hole in your lung and we're trying to open and close and open and close. Imagine what it's doing to that damaged part of her lung. It's just creating more pressure on it and potentially injuring it more. Where this ventilator, we can open, we can create a steady mean airway pressure for her, and we can just pulse those breaths in turn being more lung protective for her and letting her lungs heal.
Many preemies need help with nutrition until they can learn how to feed. She has a tiny tube in her nose called a nasogastric, or NG tube.
It used to be in her mouth, they just moved it to her nose with her cannula. And so if she doesn't take the food by mouth, it goes there, down there into her stomach. So she can grow and have all the nutrition she needs. There, see? Good girl, nice pattern. She can keep it with suction. All right, so when she takes a break, I'll see if she'll switch. So what I'm trying to do is just gently press around, get that rooting response again. And when she starts to, I can do a little constant pressure right in the midline, middle, and up a little. So it does probably look like I'm pointing it up to the roof of her mouth a little. So that's to help her bring her tongue down and latch onto the bottle better and less gagging response.
Okay.
So that's just until she accepts it. And then I'll let her put it where she wants it, because I don't want her to gag on it again. So once she takes a suck, I might give her a little bit of milk. We'll see what her cues say.
Sailor is growing rapidly now, starting out at just 2 pounds 1 ounce when she was born. Today, she's 3.5 pounds.
I didn't know what to expect when I came up here. I didn't know what to expect of how she was going to grow and all of that stuff. And so for her to get fed through a tube, I just knew right away, all right, let's get your milk. And now I wasn't sure how she was going to get it.
Abbey and her husband knew Covenant was where their daughter would be cared for, as this is the only NICU for 21 counties in northern Michigan.
We are so happy to be here. We have many friends that actually have had babies up here for a little bit of time, and they all say we're in the best place. We love the doctors, we love the nurses. They're all so good with her and so good with me.
Progress is slow at first, with Sailor getting used to a smaller pacifier before moving on to the bottle.
When babies are first born, they have survival instincts, and that's rooting and sucking are two of those that they naturally do. Well, those go away over time. We don't continue to root when somebody tickles our cheeks, so they have to learn the skill of feeding on top of those basic primitive reflexes.
It's exciting when I see her get on the pacifier. I'm glad to see that she's doing that, and it's a step in the right direction.
Sailor's mom is learning too. This is her first baby, and she loves the education she's receiving every hour she's at Covenant.
There's a lot to learn with it, and so sometimes I think we may overwhelm them by giving them so much information that there is, but it's really rewarding to when we can switch roles and then they can do the feeding and we just sit back and watch and support them through it. Oh, I need to measure your head.
Yes, you want to measure it out?
Yeah, that's really good. 9'1" and 7'6".
Larger measurements are fun reminders that Sailor will be leaving the hospital soon.
It just means that she's getting closer to coming home.
Is she interested in this anymore? Wondering after a little break if she wants to try again.
Therapy will continue until Sailor is feeding normally. It's all up to her now.
Gosh, that's so much better. It's such a huge milestone for the parent and the baby, and it's setting up a lifelong experience for feeding, for bonding and development. And feeding is a very, very important milestone for future development, even walking and crawling, according to the research. So tomorrow at 9?
That works for me.
We'll try this again. Hopefully it'll work.
When Sailor goes home, there will be some sadness from the nurses, doctors, and therapists here, but another tiny patient will soon need that same loving care. For Janelle, this is her favorite place to work.
I've been doing this since 2006, and there's no turning back. This is it for me, yeah. And I don't usually have to see adult patients anymore, and I'm okay with that. It's okay. That little hand.